Hello, sir. My name is Noe, and today I will be performing a physiological assessment. Yes, sir. The next thing I would like to ask you is to lay supine on your back. I will be assessing hip abduction. And the first thing that I would do was locate your ASIS. And towards the side here that I will be measuring today is the right side. It'd be your right ASIS. And the stationary arm would be contralateral ASIS. Sorry. And the moving arm would be on the midline of your patella. Now, the next thing that I would like to ask of you is to extend or move away your right leg towards the side of this carpet, please, as far as you can without feeling pain or discomfort. Thank you. You can go ahead and go back. Now I will be performing this bilaterally. So now from the right side towards the left side, I'd find your left ASIS and for the axis, and then the stationary arm, would be on the right ASIS, and the moving arm would be on the midline of your patella. Now I would like you to perform the same action that you did on the right side, please, as far as you can. Thank you. Now go ahead. Now the active range of motion for hip abduction is 30 to 50 degrees. Thank you. Yes, sir. Now this next assessment is the knee patellofemoral medial glide. I will be assessing the movement of your patella medially and laterally, but mostly assessing the medial glide of the patella. The first thing I will do is pinch the inferior and superior part of your patella and moving it medially and laterally, as bilaterally as well. Assessing the movement of the patella side to side, noting not too much movement medially or laterally. It should have a joint-like end feel. And the assessment for this test is he has a normal range of motion. Thank you. Yes, sir. Now I will be performing the Thomas test as well. You lying supine. For the Thomas test, it's going to assess if you have iliopsoas tightness from the iliopsoas, the muscle here in your pelvis area that attaches to your femur. And for this test, I would like for you to flex your hip at 90 degrees, bring it here, as well as your knee. And then the next thing that I would like to ask of you is to maximally flex your knee towards your chest. Okay. Now, as this assessment is being performed, do you feel any tightness or pain on your opposite groin area?
No, sir.
Okay. Now I would do this bilaterally. I would like for you to also do the same thing as you did on the right side. And now the same question: do you feel any tightness in your groin area?
No, sir.
Okay. The result for this test is a negative test, since he didn't feel any tightness in his groin area where the iliopsoas is mainly at. Thank you.
Go.
Yes, sir. Now for the next test, I would like to have you sitting down from supine to sitting down again. Now for this next test is a grade 3 manual muscle knee extension test. And the first thing that I will be doing is to stabilize your femur just above your patella and just distal from your hip. And now all I would like for you is to bring your great toe up towards the ceiling. Okay, go ahead, put it down. And I will be completing this bilaterally on the other foot, or the other leg, sorry. Okay, thank you. Now this is a grade 3 manual muscle test since the patient was able to perform this with relative ease against gravity. And the purpose for this test is to assess the quadriceps muscles, which is the rectus femoris, vastus lateralis, vastus medialis, and the vastus intermedialis, which is just under the rectus femoris. Thank you. Yes, sir. Now I would like to ask of you, since you were sitting down, to be laying a supine on your back. And for this next test, I will be performing the flexion adduction axial compression test, which assesses for labrum tears and impingement. Now, the first thing I will be doing is to flex your hip 90 degrees and your knee 90 degrees. Adducting, having hip adduction towards the midline of your body, and for placing downwards force down towards the bench and towards the floor. I would be performing this bilaterally. So can you please flip over for me? Okay, hip flexion 90 degrees, knee flexion 90 degrees, hip adduction and compression. This is a negative test, since a positive test would have a reproduction of symptoms or pain. This test has a sensitivity of 100%, which means that it's exceptionally good at ruling labrum tears or impingements in, but as for specificity, data is not available. Thank you. Okay, sir. Now that you're lying supine, I will be assessing, or I will be performing a valgus stress test that assesses the integrity of your medial collateral ligament. The first thing I will do is use my right hand on your left side. My right hand will stabilize your femur towards the bench, and my left hand is going to grab your tibia just above the medial malleolus. I will do a slight external rotation, and then I will be pulling out and placing inwards force at your knee. And I will perform this bilaterally, and can you please as well stabilize his femur? Grab your right leg just above your medial malleolus, externally rotate slightly, placing inwards force, placing inward force with my right hand, and outward force with my left. And I did that on both sides. And as we saw here, that there was no unusual movement in your knee, and also no reproduction of pain, as well as no gaps, which means that you have a negative test for valgus stress test, which means you have a nice and good medial collateral ligament. The sensitivity of the valgus stress test is 78 to 91%, which means it's rather good at ruling in medial collateral ligament tears or subluxations. The specificity is 49 to 67%, which is also moderately to good at ruling out the medial collateral ligament tears or subluxations. Thank you. Yes, sir. Now that you're lying supine, the next assessment or the next palpation will be for the sartorius muscle, which originates here on your right ASIS. And then I'd be palpating it down across your femur, up to your pes anserine right here. And now just to feel for the contraction of the muscle, I would like for you to perform a kind of figure 4 with some slight resistance. There we go, right here. Thank you. Yes, sir. Now, the next part I will be assessing or palpating, is your medial condyle. So at first I will locate your patella, from the sides of your patella, medial and lateral side here. I will follow it down. Just superior is your medial and lateral epicondyle. Just towards the bottom is your condyle. And I would perform this bilaterally. Sides here. Following it. Feeling the ridges of your epicondyles. Slightly south would be your condyles right here. Thank you.